This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And at Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
is a common condition, particularly amongst elderly men.
It was having a significant impact.
We will need to do a few investigations to see where we are.
Benign prostatic hyperplasia, or in other words, prostate enlargement, is a common condition, particularly amongst elderly men. It can sometimes cause some very bothersome symptoms, including frequent urination, dribbling, weak stream, amongst many others. I am Dr. Khawla, and we have dedicated this episode to learning more about benign prostatic hyperplasia.
So I'm 62 years old, and I've lived in Bahrain for a little over 3 years now. I'm a mechanical engineer. I love my job. It was having a significant impact. It would take me 30 to 45 minutes to evacuate my bladder, and even then I couldn't get it all out. Good morning, Dr. Das.
Hi, Richard. How are you today?
Pretty good.
Okay. How are you doing?
Overall, I'm doing pretty good. I'm having trouble as far as when I go to the bathroom.
Okay. Since how long this has been going on?
It's been going on for quite a few years now, but it's gotten worse in the last probably 5 or 6 years.
Right, I see. Can we just talk a bit about your symptoms? What are you facing?
Okay. When I go to the bathroom, my urine stream is very weak, and it takes me a long time to evacuate my bladder. Sometimes I'll be in the bathroom 30, 45 minutes trying to evacuate my bladder.
Okay. What about, do you need to go to your washroom more often? Do you feel you need to visit the washroom?
I don't. I feel an urge, but I don't have to go really that often. I don't drink a lot of water. It's I do that to prevent having to go to the bathroom so much.
Do you wake up multiple times in the night to go and empty your bladder?
Yes.
Do you feel the stream of your urine has weakened down?
Yes.
Right. Considering your age, Richard, these symptoms look more like a prostate enlargement giving you trouble. We will need to do a few investigations to see where we are.
Okay.
So these will mainly include urine check, some lab tests, and definitely we will have to do 2 other tests, which will include an ultrasound and a study called Urodynamic, which I will explain you how we go ahead.
Okay.
Any other questions you have?
No questions.
Are there any other medical problems you are suffering from?
No other medical problems.
Right. So we'll proceed with the tests. My nurse will guide you through, and then we'll catch up with the results.
Okay, thank you.
Hi, Mr. Richard. Are you comfortable?
Yes, very comfortable.
We are going to start a urodynamic study. In this study, we are going to place catheters, and we are going to fill your bladder with saline or water. And we are going to monitor the bladder pressures at different phases of filling. Once you feel that you can't hold urine anymore, you will let me know, and then we'll ask to pee, and we will again check the bladder pressures at the state of your voiding.
Okay.
Are you okay to go ahead?
Yes.
Okay. So we are going to start the test now. As soon as you feel the first sensation, you will let me know that your bladder is getting full. Okay? So the test is started. Just relax, recline your head, be comfortable, and we will keep on asking questions as we go through the test. Do you feel any sensation of filling of your bladder?
Yes.
Can you hold urine?
Yes, I can still hold.
Okay. So far your bladder sensation and the pressures are going fine. Are you feeling a strong desire to pass urine now?
Yes, I'm starting to feel a strong desire.
And are you able to hold?
Yes, I can still hold.
Okay. Your bladder pressures are still at a good range and filling is going at a good rate. Things are looking okay so far. Are you able to hold any more urine?
I'm starting to get close to needing to go.
Right. So we'll stop the filling at this point and we'll ask you to pee on this, on the receptacle which is kept underneath, and then we'll monitor the bladder pressures. So we stop the filling and now we are ready to start the voiding phase. So can you pee now?
Yes, I can.
Okay. Please go ahead. So while you're voiding, I can see the bladder pressures are going significantly high, which is significantly above normal, and it's reaching a very alarming level. Okay, so we'll discuss these results. We are done with the test. We'll discuss these results in my clinic.
Okay.
Thank you. Okay, Richard. Now we are post urodynamic study, and I'll just discuss what we found out. We also have your lab results and the imaging we did, the ultrasound imaging. So based on that, we will discuss what we got and what needs to be done.
Okay.
Okay. So your ultrasound definitely shows a significant enlargement of your prostate. We all men have a prostate gland, and as we get older, this enlarges. And this is a condition which we call benign prostatic hyperplasia. And this enlargement eventually causes obstruction to the flow of urine. With a significant enlargement of prostate, what you have, the flow is significantly affected, as we saw in the urodynamic study. And what is also happening is your bladder pressures have gone quite high. Now the problem with bladder pressures going high is if it goes at a dangerous level, it will affect the drainage from the kidney and it can lead to renal failure also. So we need to definitely address this. We have a very poor flow, which we saw in the urodynamic study, so which is all going in favor of an enlarged prostate giving you these symptoms. And we will have to plan for a procedure. Normally, we would try to give some medications, but this is a dangerously high bladder pressure, and we cannot offer you medications for this sort of a situation because there is high risk of going into retention. So what we do here is a surgery, which is an endoscopic surgery, which is also known as holmium laser enucleation of prostate, or currently known as the laser surgery of prostate. This is one of the latest technologies currently available in the world. Very safe, very comfortable. You will have a painless journey and there will be no bleeding. So we will be catching up with the preparation for the procedure. Are you happy to go ahead with the procedure?
Yes.
Okay.
Hello, Dr. Das, how are you?
Hi, Dr. Kala. How are you doing today?
Good, thanks for having us today. Thanks for your time.
Thank you.
So, Dr. Das, our topic today, or episode, is focused on prostate problems, and most importantly, benign prostatic hyperplasia, or BPH. Can you tell us, what is BPH?
So it's a benign enlargement of the prostate, which is usually seen in all men as they grow older than 40. It is mostly a histologically, some of them will have a clinical enlargement, and as we get older, the problem starts getting more and more, and it will lead to urinary symptoms. It usually starts with mild urinary symptoms and then it progresses, and if not addressed rightly, it can even lead to problems like urine incontinence, it can lead to retention, it can lead to kidney failure. So it's a very important health problem, very commonly seen in older age men.
So then BPH is not just a symptom problem that I can live with, it can lead to complications down the line if not properly
Definitely.
addressed.
So if it is not addressed and it's not taken care of at the right time, not evaluated, it can lead to grave consequences.
Okay. how would our viewers know if they might have BPH or not? So what are the most important symptoms to look for?
So commonly what we get is urinary symptoms, going to the washroom more often, waking up at night multiple times, difficulty in peeing, feeling that you are not emptying your bladder, or even a sense of urgency. These are the very common symptoms. However, as we get older, it is always important to have a check of your prostate because it's part of aging. So many times it starts with silent and patients are unaware of their symptoms and they come very late. So I recommend, all people to have a prostate check once they're around 50 to make sure that they are not suffering from a significant BPH.
Very good. And so at the age of 50 or starting from 50, anyone with symptoms or not should come and get a prostate exam.
Absolutely.
Very good. So Dr. Das, talk to us about how do we diagnose, for suspecting BPH, how do we diagnose BPH?
So firstly, it goes with symptoms. Whenever anyone walks to my clinic, we first address their symptoms, the duration, how long they are suffering from these symptoms. What is the bother score, because how severe are the symptoms, how much it is affecting the quality of life. Then once we are done with the history, we do a clinical exam. We always feel the prostate, how big it is, whether there are any concerns, because at the same time we can have prostate cancer also, so we need to rule out a cancer induced problem in the prostate. And then we proceed with tests, which are mainly laboratory tests, which includes urine and blood tests, and then we do some imaging in terms of ultrasound. Then finally, to understand how severe the obstruction is, we do a study called Urodynamic study and a urine flow rate, which are very simple clinic-based procedures, but which can tell us what's going wrong in the prostate and the bladder, and how significant is the impact of prostate to the bladder in terms of urination.
Very good. I understand we have a patient today who has generously came in and visited us today.
Right.
Can you tell us more about the patient?
Yeah, today Mr. Richard had come. He's a very nice person, and he came with suffering from urinary symptoms for quite some time. And he came to address these issues. When we evaluate him, definitely his symptoms were quite significant. And when we do his tests, we can see that he's got a large prostate which is hindering his urine outflow in a significant manner. We did a urodynamic test to see how the bladder pressures are, and it was dangerously high. So we had to suggest Mr. Richard to go for a simple endoscopic surgery which can take care of this issue.
And this surgery is to be scheduled soon, am I
Yes,
understanding?
because of his symptoms and the pressure level being high, we should proceed with the surgery as soon as possible. He's agreed for that, and we will be proceeding it as soon as he's ready.
Very good, very good. Thank you, Dr. Das, for your time.
Thank you and have a great day.
Thank you. I'll come back to see you after the surgery to check on Mr. Richard.
Sure.
Thanks a lot. Appreciate it.
Thank you.
Did you know that benign prostatic hyperplasia, or in other words, BPH, is actually a very common condition? About 80% of men over the age of 80 suffer from BPH, but not everyone develops symptoms related to BPH. Experts or scientists don't really know the exact reason why might some have symptoms and others don't. No one also knows the exact cause of BPH. People think it's a combination of lifestyle factors, hormone levels, and also genes from your family history. Hello, Dr. Das.
Hi.
Good to see you again.
Good to see you too.
So, update us, Dr. Das. What happened to Mr. Richard?
Right. So Mr. Richard had a very good surgery, was very uneventful. There was no bleeding. We could de-obstruct the prostate. We did a good shaving. And he peed well after the surgery. He had no issues, and then he was sent home right next day. He's been doing fine, and I'm supposed to see him in follow-up to see how he's doing. But I'm very happy the way things looked like and the way he went. He was very good to go through the surgery.
Very good. Will he need any medicines to take after the surgery?
Usually not. There are some medicines which we give temporary just to make him comfortable just after surgery, which are mainly pain medications and some antibiotics just to help him recover. But other than that, in the long term, he should not be requiring any medication for prostate.
Very good. Our viewers are probably wondering, does everyone with BPH need surgery? When do we send them for surgery? Are there medications that we can try first?
Yeah, so definitely a very large part of BPH, a very large proportion of patients who suffer from BPH do not require surgery. And there are different ways to handle BPH, right from lifestyle changes, medications, and then surgery is brought for situations like Richard had, where the blood pressures were dangerously high and the prostate was significantly large, obstructing his urine flow. In terms of lifestyle advice, usually we make some modifications in their coffee, alcohol drinking. We make some regular habits to emptying the bladder in periodic intervals. And then there are medications which can help in early stages of prostate enlargement. And many medications are pretty well in terms of side effects, and they are continued for a long time. So there are options, definitely.
Very good. My last question is, people think of prostate enlargement as a bad thing. Does BPH ever progress to cancer? Should that be something people worry about?
BPH and prostate cancer are two different entities. So those who suffer from BPH are not in line of getting worried for cancer. However, as you know, as men folk, we all have risk for developing cancer at any time in our life. But these are different entities, and people need not worry with BPH because it is just part of aging. And just a periodic follow-up with the urologist is what would be advised to just resolve doubts. And that's what we would suggest to all our listeners.
Very good. Thank you, Dr. Das, for having us. That was very informative.
Hello, Mr. Richard.
Good morning, Dr. Das.
Hi, good morning. How are you today?
Very good.
How do you feel now?
Much, much better.
How's your urination?
I feel like I'm a 20-year-old man.
Oh, very nice to hear. Do you had any issues with your surgery? Do you feel comfortable?
Yeah, very comfortable. Everything that happened during the whole process, you explained very well, and everything happened exactly the way you said. So I'm very happy.
Excellent. Would you recommend others to go for the same procedure who suffer with similar problems?
I already have.
Oh, very nice to know. So, in terms of your further management, Mr. Richard, you don't need any medications for prostate. We'll be just following up. If you have any symptoms, you don't need any periodic follow-up. However, as being men folk, we always have a risk for prostate cancer, so we need to keep periodically checking your blood levels for PSA, which is important, which you need to do throughout your lifetime.
Okay.
But other than that, you don't need any other management for prostate, and we are happy to see you. Anytime you have any other concerns, you can definitely come down.
Okay, thank you very much.
Thank you. Wish you a good day.
It was having a significant impact, and then when I would start drinking at night, it would cause me to wake up many times during the night to go to the bathroom. I put on a good bit of weight because I was getting most of my hydration from food instead of from water.
So my message to all those who are above 50 is to just go down to your urologist to just have a health checkup, because there are certain problems which we face as we get older. And it is worthwhile to have a health checkup, just a simple baseline checkup about your prostate, check your PSA levels just to make sure that you are not running the risk of prostate cancer. And this is done completely in a very friendly way. There is nothing to be afraid of, and these are very simple tests, and that will help us to find out if something is going wrong at a very early stage, so that things can be taken care of, addressed early, so that we have a very good outcome.
After treatment, fantastic. It's night and day difference. I can drink all the water I want. I go to the bathroom. I have a very strong urine stream. I can evacuate my bladder completely. It takes maybe a minute. I actually lost weight. I lost 16 kilos because now I was drinking water instead of eating food a lot. So that had just the weight loss itself had a significant impact on my life. I'd gotten into where I was diabetic and high blood pressure and cholesterol, and all that went away, and I stopped taking medication on it. So the surgery has had a very significant impact on my quality of life, significantly better.
Most of the urological practice in current days is endoscopic management. We are way away from open surgeries. Sometimes we do have to operate on the kidneys and we do laparoscopy. So it's more of advanced technologies, more of gadgetries rather than doing open surgery. And patients are quite interesting, the diseases are quite interesting, and they have very good outcome. So most of our patients, like those with stones or prostate, if they undergo a surgery, the benefit is quite palpable.
I would highly recommend this surgery, and I have. Just yesterday I spoke with a friend. He was telling me about his symptoms, and they were exactly like mine. It was taking him 30 minutes to evacuate his bladder. He was spending a long time in the bathroom, and he's getting tired of doing that. So I've recommended that he go to Dr. Doss. I had several business cards from Dr. Doss, and I've given them out to a couple of my friends. I've run out of those cards. But yeah, I would highly recommend any guy who's experiencing these problems to have this surgery.
In every episode of Health Hub, we bring you the latest and most relevant information to your health. Stay safe, everyone.